Okay, we will start from the question number 26. The first question is burden of disease is given by, so there are four options: crude death rate, incidence rate, cause specific death rate, and proportional mortality rate. Normally, the burden of disease or disease burden is calculated by DALY, the disability affected adjusted life years. And DALY is calculated by YLL and YLD. YLL is year lost due to death and year lost due to disability. So in this question is very given to create the confusion among the students. This is the first subject specific question. So if this is a very confusing question, if you are from a non-medical background, you see the question and you get, okay, there is no option like Delhi. So what do I do? Just skip the question if you are feeling confused. First, do the question which you are completely 100% sure of. But in this case, as we are solving it, we should know the YLD has a formula to calculate the year loss due to disability has a formula. This is a group of people with a common, sorry, this is not, I forgot to change the, so the formula is, let me show you. The number of new cases, a disability weight of the population, and the average time a person's lives with disease before death. So in this case, there is none of these options are there, right? But there is one option, the number of new cases of a disease. The number of new cases of a disease is called incidence rate. So by this way, we can conclude that incidence rate is the most appropriate answer for this question, right? For this situation, because there is no proper options like DALY or YLL or YLD. For this, we will do incidence rate is the right answer. And the next question, the question number 27 is, the secondary level of prevention include all the following except health screening for diabetes mellitus, reconstructive surgery in leprosy, case finding for falciparum malaria, and contact tracing for STIs. Okay, so finding the cases, health screening, and contact tracing, all of these things comes under secondary prevention. How do I go backward? Okay, there is a little mistake in the PPTs. I will change these things. The different preventions, like primary prevention is when we prevent the disease before it happening. Like, for example, giving the vaccine to a child, or in case like COVID vaccine, if you give the vaccine to a patient, the disease will not happen. That is primary prevention. There are mainly three types of prevention, and in case of secondary prevention, okay, I can't keep admitting you guys. And okay, and for secondary prevention, we do it to prevent the disease progressing more. Like if there is one single case of malaria, suppose, we will do the contact tracing. For those who don't know what is contact tracing, even after COVID, I guess. Okay, do you guys, any of you know what is contact tracing? Any of you? Basic idea. Okay, contact tracing is when we find a case and we try to find the last contacts they have, and a case with infectious disease, and we try to find the last contacts they have people with. So that is the contact tracing. So all of these things are preventing the disease from progressing more. But the reconstructive surgery in leprosy, it is like leprosy has already done what it had to done, and the patient has lost a limb or a finger or any part of the body, and then we are doing something to reduce the damage or keep the patient as good as possible. So that is tertiary prevention. It mainly comes on the things that comes under tertiary prevention is mostly reconstructive surgeries, rehabilitative care, this kind of things, or the pain reduction during cancer patients, those kind of things. So reconstructive surgery in leprosy is the tertiary prevention here. So here they have asked, except secondary level of prevention include all of the following, except which one? Except the third level of tertiary prevention they have mentioned is reconstructive surgery in leprosy. Then we will go for the next question. Ottawa Charter of Health Promotion incorporates all of the following key action areas except. Ottawa Charter is a charter given by WHO that gives us an idea of what to do to increase the health promotion and to make the population more aware of diseases. So it mainly gives us the idea about the preventive care. So let's see what it has. It means mainly focuses on enabling, mediating, and advocating. So first, it gives us reoriented health services. We have that in the second option. Create supportive environments. We have it. Okay, no, we don't have that. Build healthy public policy. We have that also. Develop personal skills. We don't have it. and strengthen the community action. Strengthen community action. So what we don't have in Ottawa Charter is strengthening, sorry, build social security. So if you don't know about Ottawa Charter, let's have a look. How will you solve the question? So okay. So when you try to, sorry, what, it breaks the flow so much while teaching. So we if you don't know what, how to solve the question, just look at the options. Three of the options are related to health, somehow health, right? So here in questions we can see of health promotion, and in options we will see all of you know just that what is health promotion, right? Health promotion is making the population aware about healthy habits or some disease conditions and what they should do, these kind of things. So in this case, all of these things we can see, this will help in making the population more healthy. These are health related. Only the build the social security system doesn't come, that doesn't have a direct relationship with making the population aware or making the population more healthy. Obviously the building social security will have an indirect effect. It will give the it will reduce the socioeconomic gap among the different classes, and it will help to improve the environmental conditions, but that is indirect effect, right? So all these three topic options 1, 2 and 4 have a direct effect. So as this is the third option is related to the health in least way, so that's the answer. Question number 3, option number 3, sorry. Next we go to the question number 29. Which country has the highest life expectancy rate? UK, USA, Japan, France. Okay, most of the students go for the USA option, but USA is not that much healthy. Okay, at first go for the Asian advanced countries like Japan, South Korea. I think I have made a, yeah, I have made a, this you should check because this is given by CEO World Magazine, but it was released in 2019 last, but from 2019 2023 there is a gap of 4 years. The question comes now this year, try to concentrate more on the Asian uh, progressive countries like Japan, South Korea, this kind of countries, and you have to have a little geopolitical ideas like which country has better health conditions and all. But other than that, just think first comes Asian countries, then comes European countries, and last USA. Okay, so the next options are UK and France, and after that it is USA. So our answer is Japan. Then the next question is, it is easy one. DALY, DALY. What is DALY is just the full form they have asked. Disability adjusted life year. The option number 1 is the answer. This is just, you just remember these full forms. Just remember DALY is used in calculating the disease burden. Okay. The next question is, nephrology deals with the disease of. Oh, okay. You guys have, anyone who is not from the medical background, you guys had biology in the 10th standard, right? I can't just keep teaching like this if you guys don't tell me. Okay, yeah, kidney disease, right? So you all know, right? The kidney nephrons are the units of kidney. You can write in chat also. I'm reading it. Yeah, right. So that's easy one, I guess. And what are the units of brain? Like what is brain and spinal cord made of? Any idea? Neurons, right? Okay. See, this is it is not that hard as much as you are thinking. Okay. Then the next question is, what is soiling index? The soiling index is an indicator of, soiling index is an indicator of air pollution. It is also called smoke index. This question has, they have given from the environmental sciences. The parts like COPD and asthma, these kind of diseases are related to air pollution. So they have given this question from environmental sciences and environmental and health part. And if there is a another question like what smoke index is an indicator of, that is also the answer is air pollution. Okay. And water pollution, I have tried to find some indicators. Just try to read about what, how the different pollutions are sorry, how different measured. Like air pollution is also measured by air quality index, and water pollution is measured by water quality index. And sand pollution is a new term right now coming on about how people are making the seashores dirty, and that's how it is coming out. And I have really very less idea about excreta pollution, but we will google it later. And if I see something, I will just include it in the PPT and I will share it with you. And then let's go to the next question. Horrocks apparatus estimates. Okay, this is also not a direct question. The four options are free chlorine, combined chlorine, both 1 plus 2, that is free chlorine with combined chlorine, and chlorine demand. So Yeah, when you Google it, the Horrocks apparatus is used for calculation of amount of bleaching powder needed for purification of water. Now, if we ask that what does this mean, calculation of amount of bleaching powder needed for purification of water? The needed amount of bleaching powder means how much bleaching and chlorine gives us the activated chlorine. Okay, and that helps us to clean the water, to purify the water. So when we say needed amount of bleaching powder, we understand that needed amount of chlorine. So needed amount of chlorine means chlorine demand. So that is how CVT forms the question. You have to think a little and analyze a little. So the answer is chlorine demand and option number 4. Next question is, what is the most undesirable metal in drinking water? So here also we need to have a little understanding about our physiology. Any of you had physiology, and any of you have any idea about micronutrients needed in our body? It is, I mean, I'm talking from the perspective of non-medical students. You guys have any idea about micronutrients need of our body? Okay, so let's see. There are 4 options: zinc, copper, iron, and lead. Among all of these options, zinc is needed in our body, copper is needed in our body. All these two are micronutrients. Iron is needed in our body also for hemoglobin. Only lead is not needed in our body, even for the least amount. Like we can survive without having lead inside our body, even not even in nano nutrient micronutrients in any amount. So which is not like 100% we don't need this metal. So this is the right option. Other amount, the other sorry, other this all these other metals we need at some amount in our body. Like zinc we need in a proper amount. If more than that amount we get toxicity. Same goes with copper and iron. But in case of lead we cannot have even a small amount in our body, or it will lead to toxic effects. So the most undesirable or least desirable, it can come also like least desirable metal in drinking water. The answer will be lead. And if there was arsenic, this lead option can be exchanged with arsenic. That also will be the answer. Okay, next, this is question number 35. Yeah, which of the following is not the source of indoor air pollution? So in this case we have to think from not from a houses that use LPG. We need to think about the lower class or the slum homes or very poor rural houses. So you have any idea what are the, how do they cook? Any idea, guys? Rural houses, poor people, how they survive. Any chances of repeating the previous year question? No, but you will get to know how they form the questions and what kind of the perspective they have about the questions. That is how why we are solving. It will help you understand how to think. Okay. So no one of you have any idea that how people cook without LPG gas? Yeah, using charcoal or wood. Exactly. So using charcoal or wood creates which gas? If we burn charcoal or wood in without proper amount of oxygen, any idea? Exactly. Carbon monoxide and also some amount of nitrogen oxide. So these two are source of indoor air pollution. And another source of indoor air pollution is radon. I read that somehow it comes from from soil, the radon vapor or something. And so mercury vapor is not available in our air, that it will come, or in also in our households. Mercury is not freely available, right? So mercury vapor is the answer. Just think from that environment or think from that situation. That is how you think about the CVT questions. They are mostly checking about how you have how much idea about the sector you are going to join. This is a major question. So if there are patients, you have to understand that there should not be any burning in the hospital, or there should not be nitrogen oxide in the hospital freely available, like that. And if there is something, you have to identify the source. So that is why they put this kind of questions. So next question is, which of the following is true for global warming? There are 4 options. CO2 is major greenhouse gas. This one is true. Stratosphere ozone layer is harmful. We all know that stratosphere ozone layer helps us to reduce the UV radiation, the bad effects of UV radiation. So this is false. CFC increases stratosphere ozone layer. We all know chlorofluorocarbon, that that is the main source of destruction of ozone layer, cannot increase the ozone layer. So it is also false. Now next comes the Kyoto Protocol called for 20% reduction in greenhouse emission. Now let's see what did the Kyoto Protocol call for. See, the Kyoto Protocol adopted in Kyoto, etc. Blah blah blah. It was they called for reducing their greenhouse gas emission by average of 5% against 1990 levels. So this 20% is also false. So CO2 is the major greenhouse gas. This is the true. Now for in case of protocols, these two protocols you need to study about: Kyoto Protocol and Montreal Protocol. They can give the questions from Montreal Protocol also, like this, or like for what Montreal Protocol was called for, which year Montreal Protocol was called for. But normally CVT doesn't give us the questions like history questions, like what year and all. But it's better to just keep it in our mind, right? Let's go to the next question. Question number 37. The question is: a child has multiple itchy papular lesions on genitalia and fingers. Similar lesions are also seen in younger brother. Which of the following is most possible diagnosis? So does any of you have any idea of how to like to take which take to solve these questions? Like you, okay, it's a confusing question. Let me solve it. So in first it creates, this question creates the impression that we need to understand which kind of disease it can be. It has lesions in fingers and genitalias. What can it be? But the main thing here, the main clue here given is the child has the, no, it's not allergic contact dermatitis. The thing, the child has it, also the younger brother has it. So this skin problem is contagious. That is the take we need to take. We don't need to know the what is it, the symptoms of thousands of diseases. This is talking about a contagious disease. Dermatitis is not contagious. Papular urticaria is mostly a little like a suited name for allergies. So allergies are not also contagious. So the last option left is scabies. Scabies is the right answer. So even if you don't know about the symptoms of thousands of diseases, you can solve it. Just think like this because the clue is the disease is contagious, and dermatitis is, none of the dermatitis is contagious. Urticaria is suited name for allergy, so scabies is the answer. Let's go to the next question. The question is: epidemiology deals with the study of, not the epidemic diseases. Epidemiology, okay. Did Arjun will teach you the epidemiology? Did he give any? Yeah, option C, right? You guys haven't got any epidemiology notes, right? So their epidemiology deals with communicable disease, non-communicable disease, the mortality rate, the morbidity rate, the disease burden, how many people are dying, how many fertility rate, everything. So health related issues, events and states in the population, not only about the diseases. The next question is: incidence is defined as, there are two things about having the cases of a disease. One thing is how many cases are already existing in the population, and another thing is how many new cases are diagnosed in the population. So here it is asking about the incidence, and incidence is number of new cases occurring during a specified period in a given population. Okay, should I shorten the explanations for everyone? I am asking because we can solve more questions. Oh, okay. In that case, we can solve more questions, na? And yeah, in PPT I have just included the number of cases existing in a given population at a given moment is prevalence rate. This is a formula, just remember it, just memorize it. The relationship between prevalence, incidence and the duration of illness. The option 3 is the answer, and this is the formula of calculating the prevalence rate from incidence and duration of illness. So just memorize it. The next question, this you guys have gotten the note. What is the answer? The primary health center, how much population they serves? Since they have not told us anything, there are two types of population. One is the normal plain area population, another is hilly area population. There is a difference for all PHC, SC and CHC. since they have not told us anything, we will see this rural population as a plain area rural population. And plain area, it is the answer is 30,000. Okay. Next, let's see the next question. Endemic diseases means that a disease, there are three type of disease: endemic, epidemic, and pandemic. So endemic is the disease. Okay, so any of you here from environmental sciences, or guys you have studied who have studied environmental sciences in class 10th, 11th? EVS was mandatory na. Endemic, whenever something is called endemic, the endemic population, endemic disease, or endemic XYZ, endemic is when a thing is confined in one particular place. In this case, in case of diseases, the particular one case is population group. So endemic means disease means the disease that is constantly present in one given population group, or which is more prevalent in one given population group. Like sickle cell anemia is more seen in African American people. That is endemic disease. Pandemic, we all know, that is present all over the world. We have just got out of a pandemic. Okay, epidemic, I really need to search the Google for proper definition. If you guys have any idea, like objection about the solution, you can also tell me. Okay, that no, this solution can be this. Yeah, epidemic is when one particular area is having unexpected increase in the number of disease. Like if India has a very low rate of, India doesn't have a polio in it right now. Suppose suddenly a lot of polio breaks out, that is epidemic. Or India has a very low rate of Japanese encephalitis, and suddenly a lot of Japanese people get affected by Japanese encephalitis. It will break out. It will be epidemic. Okay. Yeah. No, not endemic. Epidemic is, yeah, epidemic is occurring more than normal. And don't call me ma'am, please. More than normal later. Endemic is when a disease or anything is confined in a particular place. In this case, diseases, the place is a population group. Then goes next question. Yeah, question number 43. Primary healthcare is a, this is a known question. You guys have got the notes. How many tiers? How many tiers means how many layers there are. So there are three layers basically: the subcenter, the PHC, and the CHC. The subcenter is now government is making this approach to make increase the level of care in subcenters. So you can see it renamed into Health and Wellness Center or Sushastho Kendro. Just remember it. Subcenter is being renamed. And then the next question is question number 44. The systemic study of human diseases and social factor is known as social medicine. These I have given all the definitions so you guys don't get confused. And community, it is not, the answer is not community medicine. Community medicine is a branch that focuses on the health of the population rather than individual patient. But here, study of human disease and social factors is specifically, see, it is mentioned in the definition also, in profound interplay between socioeconomic factors and individual health outcomes. So it is social medicine. But still I am a little confused. If you guys have any better explanation, please share with me. Or in group also you can share. The next question is study of physical, social, cultural history of man is known as anthropology. These are the, like, these are, you have to memorize this. I just added the definition so that you guys don't get confused. Let's go to the next question. Society, this is also the sociology question, and this is like you have to memorize it. There is nothing much to explain. Answer number, this is option number 3, the system of relations between individuals. Then the next question is from occupational health. I don't remember if you guys have it in the in your syllabus. The answer is though ergonomics. That ergonomics simply means fitting the job to the worker. Actually, ergonomics is a study of making the work environment most suitable for the workers of it. So also I have added the, you guys can't see, I have added the definitions also. See, I've added the definitions also here. So just check it out when I share the PPT. Okay. The next is acculturation. Acculturation means the melting of cultures. In small words, we can say it is melting of cultures. So process by which individual gradually acquires a culture. The option number 4. Then the question number 49, we have is it late? Okay, just tell me when it is late. Okay, I'm not watching seeing the clock. Medical education in India is regulated by Indian Medical Council. You have to just know it as a GK. IMC. Next question is question number 50. Blank is a learned behavior which has been socially acquired. The answer is culture. This is also a sociology question. Is this type of the sociology in society or something like that, do you have in your syllabus? Come on, pages. Oh, and I have provided the definition of community. What is society and what is community? The first definition is what is society, and the second definition is what is community, because these two definitions you get confused sometimes. And as much as they have provided the questions like what is society and what is culture, I think this year it can come like what is community kind of question, or questions related to community. Last Spain was the last census held in India. This you should know. How many years gap it takes to have next census? Yeah, right, Porsche, 2011. Because we have the census every how many years? Excuse me. Yeah, exactly 10 years. This time but it was delayed. It was not done in 2021. Okay, so this question you have to know one more thing. ASHA is the full form of ASHA is accredited social health activist, but ASHA is only available in the rural areas. The urban counterpart of ASHA is called USHA. USHA, the full form of USHA is, I will add it in the PPT. It is Urban Social Health Activist. So we need to remember both ASHA and USHA full form, so there can be some questions, right? Just remember, USHA is the urban counterpart of ASHA. Which of the following city do not have aims? This is mostly like a GK question. Any guess? Actually, this was in news. That's why they have given this question last year. Yeah, Thiruvananthapuram. Right. Question number 53. So just keep seeing the news also. You know, I'm seeing that CUET gets questions from everywhere, especially the subject specific. They just assess whole knowledge of yours. And next, the myocardial infarction is term used for yeah, heart attack. If you are having no idea, suppose you are having no idea like what it means, just remember there is this cardial, so there is something like cardio now inside it, so that means it is related to heart. And stroke is not a heart related disease, it is heart related disease, but the thing that happens physiologically is in our brain. And food poisoning, kidney failure, you are getting the vibe from the answer, so heart attack is the answer. The medical doctor who deals with pregnancy and childbirth is gynecologist and obstetrician. Pulmonologist is related to lungs. Ophthalmologist, eyes. Anyone have any idea? Pedodontist? Don't Google it. Yeah, kids. No. Podiatrist. Food. Doctor is podiatrist. This is pedodontist is related to doctors who checks the teeth of the children only. And yeah, kids' teeth, right? Food doctor is podiatrist, not pedodontist. In the hospital, biomedical waste management. This biomedical waste management has a protocol. I have not added it in the PPT also. So please note it. The answer is white. There are mainly 4 kind of waste. Yeah, white dustbin is actually the wrong answer. If there was 2 or 3 answers, the white puncture proof container, especially because there are sharp objects. White dustbin is not actually the right proper answer. Red is for the blood or infected body fluid infected plastic waste. There is another dustbin that is yellow. Yellow is for infected linen, infected cotton, gauze, body parts, blood, urine, those. And the dry waste that is not infected goes inside the black bucket, black dustbin, you can say. And the vials, the glass items, and the metal items that are not sharp, like battery, those items goes inside the blue marked dustbin. And the sharp objects like needle, scalpel, and I can't remember anything right now for this moment, but these all the sharp items goes inside the white puncture proof container, PPC. PPC is important because all the this red bucket and blue yellow bucket and black bucket, there are those are plastics. The plastics are changed, but this sharp dustbin, white dustbin, the whole bucket is changed every time you get a new one, so that the scavengers doesn't get hurt by the used needle or infected scalpels. That is why it is so important to mention the PPC. So if there was two options now, why dustbin and why PPC, will get confused. That's why I'm just explaining this. Then the next question is, the medical procedure of dialysis is conducted on patients suffering from, I hope everyone knows this, kidneys. Yeah, right. There is not much to, and also dialyzer machine is also called artificial kidneys. This question, which of the following is not under the Ayush system? The full form of Ayush is, I have included here so that you don't get confused for any other questions also. The Tibetan medicine is the answer of this question. Siddha is a form of old Indian medicine that mostly concentrates on forwarding the inner core energy of our body to cure the diseases, this kind of thing. So just telling you, ICMR is the full form of, you have to just remember this kind of things. It's mostly GK. Indian Council for Medical Research. Also, just note down CS. You just need to study. I mean, sorry, remember the full form of CSIR also, CDC, and just the main agencies, WHO. The next question, this is mostly a GK question. The largest vaccine manufacturer in the world is Serum Institute of India. Actually, these things came in the news because of the COVID vaccine. The vaccine, because India supplied vaccine to a lot of countries now. So this kind of questions came outside. Then the question comes from, coronary angioplasty is conducted by, it's coronary. So I guess you guys know the answer. The answer is cardiologist. The ophthalmologist for eye doctor. Orthopedician is the doctor who checks bones. And general surgeons does the general surgeries like cholecystectomy, appendectomy, cholecystectomy. This kind of surgeries are done by general surgeons. Then the next question I will go. Indian standards for accreditation of hospitals is NABH. This question is also, you have to just memorize it. NABH gives the accreditation for hospitals. I will try to add into the PPT some of the institutes other than NABH also gives accreditation to different places like pharma companies and etc. That will help you understand. Which among the following hospital stock is part of National Stock Exchange? See, these questions are put into the question paper just to get you more negative marking. If you don't know about what is the answer, just don't go and put anything because there is negative marking. The answer is Apollo Healthcare. Then the next question is epidemiological triad. I have added a picture, and Arjun has also provided, I think, also provided or will provide the notes of epidemiology. Then the next answer is course of disease process without any intervention is the definition of. The answer is, there will be a confusion between two answers, that is spectrum of disease and natural history of disease. The answer is not the spectrum of disease, because spectrum of disease is in which spectrum the disease affects people. Like it affects the adults, it affects the kids more, or it affects all the people equally, like, or people with comorbidity more. Natural history of disease is when there is no interruption by treatment. Exactly what here they are telling, without any intervention or definition, is the definition of natural history of disease. So course of the disease process without any intervention is definition of natural history of disease. Two more questions. No, oh no, yeah, 65. No, it is. Yeah, I have solved till 65 only. So we are done today. Thank you for being here, guys. Any doubt? You can ask me any if there is any doubt, or if you need any. Don't call me ma'am. I am not a ma'am. Okay, then we should wrap up now. It's late already. It's 10. Yeah, CUT asks overall questions, both from GK and like subject specific. That means everything. Subject specific GK to subject specific everything. That is actually, see, that is the actual reason I made the give the session. Because it will help you to understand thinking. Okay, then we should wrap up. Thank you for coming to the session. I see when I can share the video.